Okay, we'll start our final session on non-infectious causes of reduced reproductive performance in cattle. We've covered a lot of topics so far, and just one more small additional topic is the effect of nutrition. This will be a very brief overview because nutrition has complex effects on reproduction and beyond the scope of this short course. So this is just a very brief overview of some of the effects. You may get more in your nutritional components of the course that you're studying, but you can also refer to other papers or review articles if you want further details. So this is just a brief overview of some of the main factors that are relevant to nutrition and effects on reproduction. In regards to nutrition of heifers, we know that undernourished heifers, puberty is delayed, and as well as delaying ovulation following the start of the breeding season, there's another consequence of a late onset of puberty. Pregnancy rates in heifers increase by about 21% from the first pubertal estrus to the third estrus post-puberty. What this means is that if heifers have to be bred, for example, the starting date is the 1st of June, then if they've had 2 or 3 or more estrus cycles prior to the start of mating, they'll be more fertile than if they just start ovulating right for the first time on the 1st of June. This early onset of puberty can increase the percentage of heifers cycling at the start of mating and increase conception rate associated with the first estrus after the start of mating. So the message is there, get heifers to cycle early before mating is needed, but hopefully 2 or 3 or more cycle lengths prior to the start of mating, so that fertility will be optimal when they show estrus during the mating period. As we mentioned earlier, body weight is a very useful guide for selecting heifers that are likely to be cycling at the start of mating. So it's really about managing their body weight and ensuring that they reach critical mating weights prior to the start of mating. If we think about cows, undernutrition can delay the onset of first ovulation post-calving and have a detrimental effect on pregnancy rates. And we've talked about this a number of times. So cows that are under nutritional stress following calving are more likely for that first ovulation postpartum to be delayed, and pregnancy rates to be lower and early embryonic loss rates to be higher. Just want to point out something that you're probably aware of, just the relationship between milk yield, dry matter intake and body weight in lactating dairy cows following calving. As soon as they calve, milk yield gradually increases and then reaches a peak approximately 6 to 8 to 12 weeks or so post calving, and then there's a steady decline in milk yield following the onset of the peak. So this is a typical lactation curve for a cow. The peaks vary between cows, the level of persistence and the slope of this curve varies between cows, but the general pattern is a peak between somewhere 6, 7, 8, 9 or so weeks post calving, and then a steady decline in milk yield after that. Now, unfortunately, the amount of food that a cow will eat, dry matter intake, doesn't peak until after milk yield peaks. So in fact, this is where they need the most energy and protein, but in fact they're not actually eating as much as they can for several weeks after this peak. So this creates an energy deficit in the cow, and this energy deficit is met by body condition. So the cows mobilize body fat or body condition in order to fill this energy gap, the difference between yield and intake. And so what we expect post-calving is, in the normal situation, is for there to be a degree of body weight loss following calving, and then a gradual improvement in body condition following calving as intake peaks and milk yield starts to drop, so that the negative energy deficit decreases, and then when it becomes a positive energy balance, they can again start to put weight back on. So this is quite a dramatic thing for cows. We know that they'll be suffering for a degree of negative energy balance following calving. The trick is to reduce the amount of negative energy balance, the magnitude of the negative energy balance that they're experiencing, because the greater the magnitude of this negative energy balance, the more severe is the effect on how much body condition they'll lose, and how long it will take them to ovulate, and then it can also have a detrimental effect on their fertility. Some of the consequences for cows being in negative energy balance, as we've mentioned several times, there's an increased days to first ovulation, so the postpartum anestrus interval is lengthened. There's reduced secretion of luteinizing hormone, decreased concentrations of insulin-like growth factor 1. IGF-1 has a role in increasing the effects of luteinizing hormone on the ovary. So if IGF levels are lower, the ovary is less sensitive to luteinizing hormone and doesn't respond as well to luteinizing hormone. So lower IGF-1 concentrations reduce the effectiveness of luteinizing hormone in the postpartum period. Other effects are delayed uterine involution. It takes longer for the uterus to repair itself following calving for cows that are in negative energy balance. You'll get a reduction in conception rates. So cows that are bred, that are actually ovulating during this period, if they are ovulating, pregnancy rates or conception rates will be less than if they are in positive energy balance, or if the negative energy balance was not as great. You'll get an increase in early embryonic loss rates. And this will have flow-on effects to the following years. So we'll have potential for later calving because conception is delayed, and then the following year they'll have a shorter interval between when they calve and when the breeding season commences. So the consequences of negative energy balance will flow through to the following year and reduce reproductive performance in the following year as well as the existing year. Okay, I'll just talk a little bit about dietary protein. Diets with a high rumen-degradable nitrogen component can result in higher concentrations of blood urea nitrogen. Remember that rumen-degradable protein in the rumen is converted to ammonia. This is absorbed by the body, and to attempt to detoxify that, it's converted to urea, which requires energy, and that urea is then excreted in the urine. So excess protein is excreted as urea. If cows happen to be eating a lot of protein, then the plasma levels of urea can rise, and this has been shown to be associated with lower conception rates in some studies. It can also change uterine pH and increases in uterine urea concentrations within the uterus as well, and possibly some altered hormone concentrations. So in some studies, adverse effects of feeding diets that have an excess protein content include higher levels of blood urea, and this has negative consequences on the uterine environment. However, this effect seems to be variable between studies. Some studies have shown a detrimental effect of high protein diets, while others have not shown any negative effect of high protein diets on pregnancy rates. When cows are grazing predominantly pasture, as they are in most of Australia, they're consuming, particularly in the springtime when the grass is very fresh and succulent, they're consuming very high protein diets in excess of 20% protein. Now these cows, if you compare them to cows that are fed a total mixed ration diet, often their conception rates can actually be greater than cows that have a lower protein diet. You think, well, why can that be? It appears that the pasture-based cows, if they're constantly being fed pasture, their liver actually adapts to this very high concentration of protein in the diet, and they are able to metabolize that urea quite rapidly, and they develop a bit of a tolerance to it. So pasture-based cows can adapt to high protein diets and tolerate much higher concentrations of blood urea nitrogen compared to cows exclusively fed a cereal-based total mixed ration diet. So this probably accounts for the fact that why some studies based on cows fed TMR diets, if you feed them extra protein, too much protein, you find that it has a detrimental effect on their fertility. But if you conduct the same sort of studies in Australia or New Zealand and on pasture-based cows that are already experiencing high protein diets, you often fail to see any detrimental effect on fertility. So what does this mean for practice? Well, it means that diets that are in excess of protein have the potential to reduce fertility in cows. If the cows are already adapted to a high protein diet, then it's probably not too much of an issue, but you should probably avoid a rapid change in the diet that suddenly raises the dietary protein levels. And so your aim should always be with nutrition to provide a balanced diet that's appropriate to the needs of the cow, and that's always your aim. The problem is there's always issues of cost, whether it's rained, etc., whether there's enough feed available, all these things that are compromising what we'd like to do. Feeding excess protein in a total mixed ration diet in particular, or a concentrate supplement to pasture-based dairy cows, is often limited by cost anyway, because protein sources or supplements are usually quite costly unless you're feeding something like urea. If you think it's an issue, then in some situations feeding diets or components of the diet that have some bypass protein, that is rumen non-degradable protein that flows through to the small intestine before the amino acids are liberated, that may be one way of reducing excess urea in the blood or excess uptake of ammonia. So this is a bit of a snapshot of some of the discussion and concern that occurs about dietary protein that you'll read about in the literature. And some people will be more concerned about it than others, and it probably depends what part of the world they're from and what sort of feed their cows are getting as to what impact excess protein can have. Another issue that is talked about a little bit is the amount of forage to concentrate ratio. Further work is probably needed to assess the effects on reproductive performance, but general observations are that cows that are fed high amounts of cereal concentrates, particularly dairy cows that might be fed 7 to 10 kilos per day of a concentrate, in addition to their pasture-based diet, this may have a detrimental effect on fertility. The reason farmers do it is because they're trying to get more milk production, but maybe those high concentrate diets, particularly if there's subclinical acidosis occurring, may have a detrimental effect on fertility. The effect on fertility in these cases is probably multifactorial, and we're not quite sure what all the different factors are. If there's less effective fibre in the rumen, there may be some reduction in ruminal function and a lowering of rumen pH, and this may be a factor that's having a detrimental effect on fertility. I won't talk about this much, but if you're feeding a transition diet, particularly to lactating dairy cows, so you're feeding a diet in the last 2 to 3 weeks of gestation before they calve, then this diet should be appropriately formulated for the needs of the cows. And again, if it's done properly, that can reduce postpartum and estrus intervals and improve fertility in the postpartum period. There's just some websites if you're interested to look at it further, or you may study the topic when you study nutrition specifically. Again, this is a very quick snapshot of some of the vitamins and minerals that if they're deficient, they are known to have detrimental effects on fertility. Some of the ones we know about include phosphorus. Phosphorus deficiency is quite a significant cause of reduced reproductive performance, particularly in northern Australia. It's a big cause of long postpartum and estrus intervals. Selenium and vitamin E, particularly in coastal high rainfall areas, can cause a reduction in pregnancy rates, and in these cases, if you know it's deficient, then it does pay to be able to supplement with those. I recall one case with a particular practitioner working in part of Victoria, and he said if he supplemented heifers in his region with selenium and vitamin E, he would boost pregnancy rates by approximately 10%. Iodine deficiency can be associated with a number of congenital issues and can affect reproductive performance. Copper, manganese, cobalt, these are also been documented when deficient can also affect reproductive performance. Vitamin A, particularly if you're trying to breed in the dry period where there's just complete dry feed available, then sometimes supplementing with vitamin A in those situations will be helpful. Cows that are eating a lot of green grass, usually there's plenty of vitamin A in that feed. And then zinc deficiencies on occasions. If zinc is deficient enough, you can get potential reduction in fertility. Some of the mechanisms of action, this is not a complete list, but you can get a decrease in the activity of rumen microorganisms and decreased digestibility. Some of these vitamins and minerals are necessary for normal rumen bacterial floral function, and so if they're not present, that can affect their ability to digest feed. Altered enzymic action can alter the energy or protein metabolism, or in fact hormone synthesis at the cellular level as well. You can get a reduced integrity of reproductive cells, cell membranes, and so a reduction in antioxidant effects associated with the use of a deficiency of some of these vitamins and minerals. Reproductively, what are the symptoms we may see associated with a vitamin and mineral deficiency? We may see a reduction in conception rates. This is probably one of the first things that you'll notice. Prolonged postpartum anestrus intervals, a reduction in dry matter intake or digestibility, an increase in embryonic loss rates or abortion. Retained placenta. This is common, particularly with selenium vitamin E deficiencies. And you may also see increased perinatal mortality. So the calves are born, but they don't survive very long in the neonatal period. And sometimes this may be associated with things such as iodine deficiency. So a brief snapshot just to give you a quick overview that if vitamins and minerals are deficient, then this can have a negative impact on reproductive performance. Other factors which we won't spend any time talking about that can be detrimental to reproductive performance: any sort of systemic disease that makes cows sick. If they're lame, this can have a big effect on their reproductive performance. And if they're stressed in any particular way, transported, mishandled, we talked about high temperatures or extreme low temperatures, or if they're socially stressed, so that you're constantly mixing new cows together, so they've got to keep establishing their hierarchy. All of these things can have reduced impacts on reproductive performance. Elevated levels of cortisone associated with stress can have a negative effect on LH secretion and also suppress the pre-ovulatory LH surge. So particular stressing at the time of expected estrus is not recommended. This just gives you a bit of a summary of some of the things that most important factors that can affect the establishment of pregnancy in cows. First of all, we want to minimise body condition score and resolve postpartum uterine infections if they're present. We want to detect heat accurately, efficiently, and we want to inseminate cows at the correct time in relation to the onset of estrus. When follicles ovulate, we want them to ovulate oocytes or follicles that have high quality, and we know that there are things that can affect the quality of these eggs. In the early post-ovulatory period, in the first 3 to 7 days post-ovulation, if concentrations of progesterone are too low, this can affect embryonic growth rates and influence the amount of interferon tau that are produced. We want the uterus to produce enough uterine milk, or what we call histotroph, to nourish the embryo as it develops. This is a schematic diagram of a developing embryo. We also want that embryo to grow quite rapidly and produce enough interferon tau by day 14 to 18 to prevent luteolysis occurring. And we want ongoing maternal recognition of pregnancy around about the time of expected luteolysis. So this is just a quick summary of some of the things that are important in regards to the establishment of pregnancies in cows. So this really completes brief overview of some of the major factors that can affect reproductive performance in cows. It's just a few review questions on the nutritional component. What are some minerals or trace elements that when deficient may be associated with reduced reproductive performance in cattle? And what are some of the reproductive symptoms that may be associated with dietary deficiency of a mineral or a trace element? If we look at the first one, phosphorus, selenium, vitamin E, iodine, copper, manganese, cobalt, vitamin A, zinc, these can all, when deficient, affect reproductive performance. What are some of the symptoms we see? Reduced conception rates, prolonged postpartum anestrus intervals, reduced dry matter intake or digestibility, increases in embryonic loss rates or abortion rates, retained placentas, and an increase sometimes in perinatal mortalities. I've listed at the end of these slides just some general review questions. I won't go over them, but you should perhaps have a look at them, and based on the material we've done over these last number of sessions on factors that affect reproductive performance, see if you can provide some answers in your own time for these. If there's any questions, then drop me a note and I'll see if I can help you out.